Good evening and welcome to Viewpoint. Coming up tonight, we speak to the acting medical director about the recent difficulties at the primary care centre. He says GPs and other healthcare professionals need to recover after not being able to take much leave for a year. But how can they do that and address the backlog in the delivery of healthcare services resulting from the pandemic?
I think we've been through our surge now, so I think things will settle a little bit.
We'll also hear from Together Gibraltar's leader Ms Hassan, Nahon, who says any insinuation that problems of access to appointments at the PCC are linked to staff absenteeism is an insult to a workforce that's carried the community through a pandemic.
This is coming as a result of government cuts and austerity, purely and simply.
And the Chief Minister replied to Ms Hassan, saying that there's no question of spending cuts to the health services over the next financial year.
That when we start to have the debate and the numbers become public, what she has said will be demonstrated to be untrue.
First, COVID-19 is the biggest event the GBC newsroom has ever covered. We feel a huge sense of responsibility to get the tone right, the messaging right, and also to show people the reality of what's going on in our hospital. In spring last year, we spoke to intensivists, doctors, nurses, midwives, cancer specialists, paramedics, and others about how they were preparing for a surge in COVID cases. Our health professionals were keen to speak to GBC and share their experiences of the pandemic so far, the planning they were doing, and the precautions they were taking. Their professionalism shone through in our reports. They helped us to show the public the GHA's preparedness for COVID-19. In early January this year, as cases soared and a second lockdown was announced, the GBC newsroom knew it was time to get back to the reality of what the virus can do, to show people what health professionals were having to cope with. In the first week of January, we spoke to the medical director and the director of public health. Both suggested the medical professionals making up the GHA's Gold Command were in favour of GBC being allowed access to document the medical reality of the pandemic. It was suggested we should film inside the critical care unit, Rainbow Ward, COVID wards, the 111 call centre and accident and emergency. We formally requested permission to film inside the hospital on the 7th of January. We added ERS to our request later. The press office told us that the health minister had said no. In the following weeks and throughout February and March, we tried very hard to persuade the government to allow us in. We were told verbally that there were good reasons not to allow us in: infection control and patient privacy. In many countries, this combination of health worries and privacy concerns have made it difficult for journalists to go into hospitals and capture a portrait of this part of the pandemic. But in many cases, the news crews and the hospitals and authorities have been able to overcome these concerns. You've probably seen powerful coverage in the UK and Spanish media. The only footage of busy COVID wards our viewers have seen on GBC is footage taken in the UK, Spanish and Italian hospitals, as we were not allowed to film inside Gibraltar's.
I couldn't get upstairs without popping and panting.
Always wore a mask, number of contacts with people kept to a minimum. So I always took it seriously. Taking it even more seriously now, you know. I want to see how vicious it is, it's nasty.
A picture tells 1,000 words. We felt GBC viewers deserved to see sensitively filmed footage of our wards here at St Bernard's Hospital. In the same way as GBC viewers expressed gratitude for our reports from inside the hospital last spring, others have questioned why our cameras did not show them the inside of the hospital or ERS during the deadly wave that claimed so many lives. The reality is it is against the law to film inside the hospital without permission. We tried hard in January, February and March to get that permission, but it was not granted. We did film interviews inside the hospital in that time, but only where the vaccination programme was being delivered and on the top floor where the Minister and the Medical Director have their offices. As to filming inside the wards and speaking to health professionals there, we appealed to the Chief Minister directly. He said he understood why we needed to see and report on the front line of the pandemic. His press office tried to facilitate access through the office of the Health Minister. Unfortunately, it got stuck there. There's a bit of a twist in this tale. GBC now knows that 2 weeks after our initial request, the Health Ministry made a proposal to senior GHA staff for a private company to be brought into the COVID intensive care unit and COVID wards, so that vetted images could be issued to the media without the media themselves being given access. We know that a conversation was had among health professionals about how to mitigate the risks and how PPE and time in each ward would be best managed. We've seen this in writing, black upon white. The Health Ministry was prepared to invite a private company into the CCU and COVID wards while denying access to the public broadcaster GBC. The International Press Institute has urged governments worldwide to recognise the crucial role of independent news media in the coronavirus pandemic, and to ensure that emergency measures to tackle the disease are not used as a pretext to censor news or interfere with media freedom. COVID-19 poses a major threat to global public health, and the free flow of independent news is more essential than ever, both in informing the public on vital measures to contain the virus, as well as in maintaining an open dialogue and debate on the adequacy of those measures. In summary, we wanted to show you, sensitively, what the deadliest weeks in Gibraltar's recent history looked like, how doctors and nurses were coping with the pressure, and the no doubt excellent care our hospitalised COVID-positive patients received. We wanted you to know GBC was unable to do this as permission was not granted. Media independence is a core principle underlying democracy. COVID-19 is a public health crisis, but it should not be used as a pretext for restricting the public's access to independent information. You're watching Viewpoint. An investigation into the availability of GP appointments and the effectiveness of the PCC telephone system found 3 times the number of GPs permissible were absent in recent weeks. The government says this has coincided with an increase in the number of people wanting to see a doctor and a backlog from the COVID lockdown. The acting medical director told GBC the situation was also compounded by a surge in people complaining about seasonal viruses. Dr Rawal, thanks a lot for talking to us. We know you're a very busy man. How would you characterise where the primary care centre is at the moment in its services?
Okay, so it's been a difficult couple of weeks from all sides, from the primary care side, and I know from the service users side, and I know there's been a lot of frustration out there. And of course, you know, I don't want our service users to be frustrated. But really, there are lots and lots of factors that have gone on with that, and we need to make a lot of considerations for that. So a couple of weeks ago, we've been incredibly mindful, certainly since the COVID cases started to reduce, that we needed to come back to some semblance of normal service, of course. And one of the key elements of that, which has been missing for a long time over the last year, has been face-to-face appointments with a GP. And of course that has been a necessity because we couldn't afford to bring people into an area of high risk, namely risking them catching COVID. So we announced a couple of weeks ago that we were starting face-to-face appointments again. Unfortunately, we had an almost unanticipated demand, a huge surge in the number of people who wanted to see their GP again. You know, as I say, the unanticipated, in actual fact, as I say it, I almost think, well, of course, people have been without their GP for almost a year, so they're very keen to get back to seeing their GP. So we had an enormous surge, all of a sudden, which overwhelmed our telephone services, and just a demand that was much higher than the number of appointments that were available at the time. We then add to that a number of other issues, including a couple of bank holidays that went in over the last couple of weeks. We've had a couple of our GPs away sick, and everything just kind of came together at the same time to provide what seemed to the service user to be a distinct lack of appointments. It wasn't necessarily there were lack of appointments, it's just that the demand was so high.
So a difficult few weeks, but
Yeah.
the primary care centre GPs have been seeing patients and have been beginning to address the backlog.
Absolutely. In fact, you know, of course, across the board throughout the pandemic, much of, say, the hospital services, for example, have been significantly reduced. But primary care is one of those elements that has never really closed. We've delivered our services just in a very different way, primarily at a distance with telephone and with email and with repeat prescriptions being done kind of slightly remotely. But primary care has never closed. And it's interesting when you look at the numbers of appointments that we are currently providing versus the number of appointments and telephone calls that we receive, say, pre-pandemic, the numbers are almost identical. So we've not reduced our services anyway. We've had to adapt. And a really, really good example, say throughout the pandemic, is that we had to take into account something called a flu clinic, which is essentially almost like a pre-clinic for people who had symptoms that could have been COVID. So we would bring people in to be seen in that kind of clinic before they went into a routine clinic where potentially, if they had an undiagnosed infection of COVID, they could have taken it to other people in the waiting room. So we've had to duplicate services in many ways. So the fact that we've maintained services despite almost having to duplicate and add services within the existing resources just shows how hard our GPs have worked. They've sacrificed their annual leave, they've sacrificed their family time, all of these things over the last year. So they've worked incredibly hard. And it's just very unfortunate that over the last couple of weeks the demand has been so high that it has felt to our service users that the GPs haven't been providing. In fact, it's quite the contrary.
So in terms of numbers, the number of appointments currently being carried out, if we include the virtual appointments taken with face-to-face, the combined number is similar to pre-pandemic, but what you're saying is that there's been a surge in the number of people wanting to see a GP because of the backlog.
Yeah, absolutely. And of course people have long-term chronic conditions, and they have their long-term blood pressure medications, and they have problems that they've essentially been sitting on and they very wisely kept away from health services. But they are now at that point where we made an announcement saying, come back to your GP now, we're having face-to-face appointments, and they've quite rightly said, okay, I'm coming, I've got a problem, I've been sitting on it, managing it myself, but I'm a bit worried about it now. But
so even though the primary care centre hasn't stopped offering a service, the health users perhaps haven't engaged as readily with their GP virtually, and now that they can go face to face, they want to avail themselves of that opportunity.
And that's not something that has been specific to Gibraltar. That's been across many countries where people have been essentially have listened to the public health advice, but have also been afraid to come. Mm-hmm. So I'm sure there are people out there who have maybe small, low-level medical conditions, or even things that need to be seen that haven't been looked at as closely as they should. And of course now they've quite rightly said, right, I'm coming now. You're telling me I can come, I can come. The trouble is, of course, everybody's done the same thing. And that's overwhelmed our services. But we are now in a process where we are now catching up. We're providing more availability. My GPs have cancelled a number of different things. They've flexed their leave. They've cancelled some of the time which we would normally allocate to them doing administration and checking results and things like that, to provide an availability to deal with our surge until we reach a kind of more steady state.
So this is a different surge, but one that needs to be responded to creatively also. Think that there may be somebody watching this who's not sure whether they need to see their GP face to face. Could you give us a steer at all, the sort of question that they need to ask themselves as to whether they can have a remote consultation or whether it is something that should be best dealt with face to face?
Yes, of course. So, I mean, it's quite a difficult question to answer, really, because everybody's case is different. And of course, some people may just have a medical condition which they go, no, I'm not going to bother about that at the moment. They might put it off. Some people may have a much lower threshold to come and seek medical care. And of course, we are clearly saying that try not to sit on things. That might sound counter to the fact that people are struggling to get an appointment, but we are definitely saying very clearly, if you have a medical condition, please don't sit on it, or don't sit on it for too long, and do come and seek some advice. And perhaps if you're a little bit unsure, maybe a telephone consultation as a starter is a good way to get some advice and say, I'm a bit uneasy about this. Ask the question of a medical professional and say, what do I do? Do I need to come in? And maybe that's sometimes the best way, because telephone consultations, telemedicine is a very efficient way of delivering care. We're delivering telephone consultations as a proportion of the overall number of appointments that we provide every day, something that actually we didn't do pre-pandemic. And what that...
about a third? Hmm?
Yes, about a third at the moment, yes. And of course that's a situation we will monitor depending on demand. Interestingly enough, the telephone consultation model is a very well tried and tested model. It's a very popular model.
Worldwide, but fairly new.
Absolutely new for us, and something which was introduced really by necessity throughout the pandemic, but something that we definitely want to hold on to. It's a very successful model. And it's interesting if many service users can cast their minds back to perhaps pre-pandemic, or perhaps even when primary care was located in the ICC building, and there were times when queues would be snaking out of the door waiting for people to get in a face-to-face appointment. And that for people was very difficult because it almost excluded people who couldn't do that. People who had families to look after, people who were on the school run, people who were working. And so providing a portal via telephone for people to request a phone call and speak to their doctor at their convenience while they're in work has been incredibly popular. And so we have managed to provide an enhanced level of service to a proportion of our community who perhaps in the past have struggled to get an appointment.
So effectively there's an equivalent number of appointments to speak to a GP as there was pre-pandemic. So in that respect you're more or less returned to normal level of service, but there is a lower number of face-to-face appointments now because the difference is made up by telephone consultation. So 160 more or less per day are telephone and the remainder.
The remaining balance, taking us up to, on average, on a daily basis, depending on the day and depending on the different clinics that we have configured, specialist clinics versus general clinics, we can provide anything between 450 and sometimes up to 550, maybe beyond, in terms of numbers of appointments. It's very dependent on the day. At the moment, we're providing about a third of those with telephone. What that doesn't mean is that there's a net effect of less appointments overall. It means just the way we're delivering care is different. And going back to one of your original questions, in terms of somebody just trying to work out whether they need to see their doctor, whether they're better off with a telephone consultation or not, I would say maybe seek a telephone consultation. I've said it before, but seek a telephone consultation first. But there are many occasions when there are other ways to access that care. So if you have a long-term chronic condition, perhaps something like a high blood pressure for which you take just a blood pressure medication, these kind of chronic conditions don't always need to be seen face to face by a doctor. A lot of the evidence from the Royal Colleges in the UK in particular, and across some of the other health jurisdictions in the world, say that for a well-controlled, well-monitored chronic condition, you don't actually need to see your doctor more often than once a year.
Once a year.
Yeah. So of course that for many people seems to be too long. And I know that will create worries and anxiety that maybe things are going wrong for people and I can't possibly wait a year to see my doctor. But even if it was just say once every 6 months, that's better than some people who have felt more comfortable coming once every 2 or 3 months. And actually if you came every 3 months and your condition was so well controlled that you didn't really need to come more often than once a year, you've actually had 3 additional appointments that perhaps somebody else could have used. So it's very difficult, and I understand it from a service user perspective. It's very easy for me to sit here and say, only come once a year.
There's the condition and there's perhaps anxiety around the condition.
Absolutely right. And there's a level of reassurance that comes with this as well. Am I on the right medication? Is my blood pressure controlled? Is my home blood pressure machine, for example, reading accurately? So there are lots of other things that go with it. So providing healthcare is not simply a case of doing a quick blood test or a quick blood pressure and giving a medication. There's a lot more to it, and we definitely understand that, and I don't doubt that that's a lot of the reason why we've had such a big demand. We are doing our absolute utmost to provide as much as we can in terms of face-to-face. I know people would like to come back and see their GPs, and we're doing our very best to do that.
Okay, on the face of it, there seems to be significant tension between the demand, the surge, as you've called it, for primary care services, people wanting to see GPs, and on the other hand, GPs needing to take a break, catch up on some leave, do things outside of work, which they've put on hold during the pandemic. Is that the case? Is there a tension?
Well, I don't know whether it's a tension or maybe a mismatch. And maybe the first thing really to say, and probably perhaps the most important, is every single GP and every single clinician and every single member of the GHA, we certainly understand from the service user's perspective that's what we're here to do. And when there's frustration from a service user, from a patient trying to get an appointment, or there's a difficulty and the distress that's caused, we are very, very quick to apologise for that, because because it must be very difficult. And I am very sorry for people who have really, really tried to get an appointment and found that very difficult in the last couple of weeks with their GPs. But there are a lot of factors that go with it, as we've already discussed. But we have to also remember that our GPs are humans as well. And just a little interesting, just slightly aside statistic, in the last couple of weeks, to go with that surge in demand, we also had a community rise in a number of different viral infections. Things actually we'd almost forgotten about because we're so focused on COVID. A little bit of, just stomach upset, a bit of coughs and colds and things like that, which kind of hit the community at the same time, which is about right at this time of year. April is a kind of wet month. We get a rise in these kind of viruses. And so the community, of course, wanted more appointments because of that as well. But GPs are part of that community. So we did have a number of GPs who were away sick with exactly the same thing. We also have on the background GPs who have cancelled their leave over the last 12 months. They've sacrificed everything from just working through clinics, long clinics, long 12-hour days. They've not seen their families. They've not had their rest and recuperation time. And I don't know about you, but if I go and see my GP, I would like my GP to be refreshed and sharp. I don't want an exhausted GP. So we also have to really bear in mind that we have had GPs who worked incredibly hard. And so during a period where we've had bank holidays and a time when people could take the opportunity, children were off school, families were off as well, that we could put some of our clinicians with their families, give them a little bit of rest and recuperation. That meant that we actually gave just a few more GPs a little bit more annual leave than perhaps is that dictated figure that we see.
So there's an existing agreement that only 5 GPs out of the 28 contracted GPs should be unavailable from the primary care centre at any given time, but during the past 2 weeks there have been 15 away from work.
Yeah, so
that's 3 times the figure.
Absolutely, and of course, if you say the figure just in isolation like that, it seems an enormous figure. But the 5 GPs away at any given time is in a non-pandemic time. It was an agreement and a policy that was written long before COVID hit and long before the exhaustion and strain of a 12-month pandemic so far impacted on all of our clinicians. Added to that, we have to bear in mind that GPs are community doctors. They're not simply doctors sitting in an office waiting for people to come. We provide other services as well. We provide services outside of the community, such as home visits. We provide services to Ocean Views. We provide services to the prison, for example. We provide services to all members of our community, and that often means taking GPs away from sitting in an office to go and deliver care, often to the more vulnerable, the more needy side of our population, actually. We also ask our GPs to provide certain specialist services, such as dermatology, for example, musculoskeletal services. All of those are part of primary care. They're part of primary care services. We also have GPs on call. Everybody knows we have a GP on call every night, but I can't keep a GP on call for 24 hours without giving them the day off the next day. So if you take into account the annual leave, we have GPs who are off sick. We have GPs who are essentially what we would call off duty, so post on call. And we have the GPs within that 15 who essentially weren't doing general GP services, but were doing specialist services or doing solely house visits and things like that, taking medical care to people that need it. So the number in itself seems like a lot, but what it actually, to me, what it illustrates very clearly is the demand on primary care services and the pull on primary care of all the services that we need to provide.
You've apologised.
Absolutely.
Does that mean that perhaps you didn't anticipate the effect that this number of GPs being off at the same time would have?
I'm apologising because I think it's fair to apologise to our frustrated service users, and I think it must be very difficult, particularly if you're not well and you're trying to get through and you've been on the line for 30 minutes or 40 minutes, and then at the end of that you're rewarded with there's no appointments available. It must be infuriating. Particularly, like I say, if you're not well and you need to see your GP and you want to see your GP, and actually the message has gone out saying, come and see us. And then we say, well, we've got no appointments for you to be seen. So that side of it is definitely an apology, but there's so many different factors that have gone into to counter that. Did we anticipate that there would be demand and that numbers of GPs would be away? I think I think perhaps what we didn't anticipate is the sudden surge, and the other little factors. That slightly often used phrase, a perfect storm. Sometimes these things come in where there are all sorts of factors you just can't anticipate. I can't anticipate for a GP that's going to get sick. I can't, but they are going to get sick like everybody else. I can't anticipate for the fact that I'll get a sudden rise in viral infections on that particular week. So there are a number of little factors that have gone in. Maybe in isolation, each of those factors perhaps wouldn't have had such an impact, but that all combined with a massive surge is what's left us essentially just on the back foot a little bit.
The government has spoken about an investigation into the past 2 weeks at the primary care centre. What's the nature of that investigation? Because the term sometimes conjures up the threat of disciplinary action or something. Is that what we're talking about? Or
No,
just
not at all.
An understanding?
Yes, absolutely understanding. Looking into the factors to try and explain it. We need to look into what's happened to learn our lessons for the future always. That's how we develop, that's how we grow, and really just sitting down with the GPs as a body. They are ultimately the people delivering the service. If anybody knows primary care well, it's the GPs. They are our subject matter experts. So sitting down there with them, with the GP leads, who are essentially the local managers within primary care, and the GPs as a body, and say, okay, look, this is a problem we've anticipated, or we've not anticipated. This is a problem we've experienced. How can we now catch up? How can we provide greater availability, and how can we prevent this happening again in the future?
You've spoken about the strain on health services and the fact that doctors have had to cancel their leave, and I mean the pressure really, I suppose, has been unprecedented in recent times. There's nothing to compare it to. What's your plan to return to business as usual, to get to a place where you've caught up with the backlog, as well as given those doctors a chance to rest and recover?
Yeah, so it's a very, very difficult balance, because we are here to provide healthcare services and care to our community. That's what we're here for. But we also have to look after the people that we employ and make sure that they are well and on top of their game so they can provide the best level of service. So it's a very, very difficult balance. And added to all of that, as you've mentioned, we have a catch-up where we have people who have not been seen, and that's not just primary care, that's across the board throughout all the clinical services, who are waiting to be seen, who have been on waiting lists or referred, have not been seen, have been essentially on hold for a long time. So it's a balance. It's not a balance that we're always going to get right, and perhaps the last couple of weeks have shown us that sometimes the balance will tip away, not in our favour. There are many of these services that if you look to some of the other countries like the UK, for example, some of the clinical specialties in the UK are saying that they're not going to catch up for up to 4 years. We are working and anticipating catching up with a number of the clinical services, hopefully by the end of the year. So that gives you an indication of how hard our clinicians are still working, but they are exhausted. And so I've got to give them some time. I've got to accept the fact that I need to put things in place to allow patients to access the services, but at the same time allow people to take some rest. And maybe that rest is just a few days here and there, as opposed to a big block of leave. Many people have got enormous numbers of days of leave, and if I gave everybody leave today, I might as well shut the door and come back in a few weeks' time. So, but we've got to manage it properly. We've got to. So I'm not saying that to ask our service users, our patients, the general public, to essentially accept the fact that they can never ever get through. And we need to know about that. And if they're struggling with that, then clearly we need to know. But I would also just ask people just to be aware that we have to balance these things, and it's a difficult balance, and we won't always get it entirely right.
So you hope that some clinical services will be caught up by the end of 2021, but others won't have and will take longer?
Yes, inevitably they'll take longer, but I'm hoping some. I can't give you specifics as to which ones. I mean, this is just an ongoing monitoring process. We're doing our absolute best, because of course if you think about a clinical service, there is almost like a day-to-day presentation of a specific medical condition, and there's the ones in the backlog. So we have to deal with the day-to-day, and we have to deal with the backlog at the same time, which means increasing the availability of interventions or images or surgeries or primary care appointments or whatever those things are to deal with those backlogs. So we're just monitoring every single specialty to see how they get on. We're doing our best really, I suspect the only specific I could give you, which is not specific, is we're going to do our best to catch up as quick as we can, as best we can. I certainly don't anticipate taking as long as a number of other countries to do, but we are also very lucky that we have clinicians working incredibly hard and have put in the extra hours, very dedicated to bringing these services back as quick as they can.
And you expect to have to do so largely within existing resources?
Absolutely, yes, because we're within existing resources, partly because that's all I've got. We also have to bear in mind that in the global market for healthcare professionals, every other jurisdiction is doing the same thing. So of course they're desperate for their staff. It's very difficult for us to bring staff in. If you remember it, almost this time last year, we had an aeroplane that came in and brought 20 or 30 members of staff to help boost us, but that's now something we can't do because everybody else is doing the same. And of course, COVID, as you've seen the articles in the media, COVID has been an incredibly expensive 12 months. So we have to be very careful how we manage our resources as well, but at the same time delivering a proper level of care.